Bupropion is a medication typically used for depression, while naltrexone is most often used to treat alcohol and opioid addictions. When you combine them, what do you get? Apparently, a drug to treat obesity. Let's talk about 3 different drugs, bupropion, naltrexone, and Contrave, and explore why these medications are being used to treat weight loss, as well as compare how effective each might be. Bupropion is a medication known primarily for treating major depressive disorder. It's an antidepressant and it impacts neurotransmitter levels in the brain, particularly norepinephrine and dopamine. However, unlike many other antidepressants, bupropion typically doesn't lead to significant weight gain or cause sexual dysfunction. In fact, it's considered weight neutral and may even result in weight loss for some individuals. It's also approved for aiding smoking cessation by alleviating withdrawal symptoms and reducing the urge to smoke. Bupropion's possible weight loss effects are especially beneficial for those quitting smoking, because smoking cessation is often associated with an increase in appetite and weight gain. The exact mechanisms behind how bupropion affects weight aren't fully understood, but it's thought to involve its influence on the neurotransmitters norepinephrine and dopamine, which play roles in appetite regulation and reward pathways. Bupropion increases the levels of these neurotransmitters in our nervous system by preventing them from being removed by our bodies, contributing to reduced appetite, decreased psychological cravings, and potentially increased energy expenditure. Research suggests that bupropion can lead to weight loss of around 7 to 10% of body weight, but when compared to a placebo, the actual weight loss attributed to bupropion is closer to 2 to 5% total body weight. However, it may take some time for bupropion to show its effects. While a few people do notice some weight loss by 8 weeks, most people may not see much of an impact until around 24 weeks, unlike medications like Wegovy, which can cause rapid weight loss in as little as 4 to 6 weeks. Furthermore, bupropion's mode of action suggests it may be more effective in addressing the emotional aspects of weight loss, such as food addiction and emotional eating, rather than straight up suppressing appetite, like drugs such as Ozempic or Mounjaro. So bupropion is often used to help break food addiction, but may not affect overall appetite as much. Naltrexone is a medication used mainly for helping people manage opioid and alcohol dependence. Acting as an opioid receptor antagonist, it blocks the effects of opioids, helping in the treatment of opioid addiction by reducing these cravings. Moreover, naltrexone has proven effective in addressing alcohol use disorder by lessening alcohol cravings and the feel-good effects of drinking alcohol. The exact ways in which naltrexone contributes to weight loss aren't entirely clear, but it's believed to involve the adjustment of brain pathways linked to appetite regulation and reward. As an opioid receptor antagonist, naltrexone may impact the brain's reward system, reducing the pleasure associated with eating. This can result in reduced cravings and less motivation to overeat. On its own, naltrexone doesn't directly influence weight, making it unlikely to be an effective standalone solution for weight loss. However, when paired with bupropion, it seems to be particularly helpful in supporting bupropion's effects on reducing cravings in individuals dealing with obesity, especially those struggling with emotional or binge eating patterns. It is the combination of bupropion and naltrexone that creates Contrave. I've discussed the detailed use of Contrave for weight loss in another video, and you can find the link in the description below. One notable advantage of Contrave is that it achieves significant weight loss with lower doses of bupropion and naltrexone compared to using bupropion by itself. Typically, bupropion requires a minimum of 400 milligrams per day to be effective, with even slightly lower doses of 300 milligrams proving to be significantly less impactful. Naltrexone, even at 100 milligrams, doesn't show any noticeable effects on weight. In Contrave, however, only 90 milligrams of bupropion and 8 milligrams of naltrexone are needed to achieve significant weight loss. Using lower doses reduces the likelihood of side effects, making Contrave a safer long-term option compared to using bupropion alone. Research indicates that Contrave can result in a weight loss of around 11 to 22 pounds, roughly 5% of body weight when adjusted for a placebo effect. This means that Contrave adds an extra 5% weight loss on top of any weight loss achieved through other dietary or lifestyle changes. So how do these three drugs compare? Firstly, only Contrave is officially approved for weight loss. Bupropion might have some impact on weight, but it isn't officially approved for weight loss. In terms of cost, Bupropion and Naltrexone come in generic forms, making them much cheaper compared to Contrave, which lacks a generic version. Bupropion goes by the brand names Alplezin, Wellbutrin, and Zyban, while Naltrexone is available under Revia, Vivitrol, and Depade. It's important to note that the brand name drug Narcan is not Naltrexone, it's naloxone. Although both naloxone and naltrexone counteract opioid receptors, Narcan, which is naloxone, is primarily used in emergencies for opioid overdoses, swiftly reversing their effects. On the other hand, naltrexone is employed for ongoing management in opioid addiction. Now, in terms of dosage, Contrave utilizes lower doses as it combines both drugs synergistically. Lastly, their effect on weight loss and the supporting research vary. Bupropion has mild to moderate effects and is more beneficial for those dealing with emotional eating or food addiction. Naltrexone by itself doesn't contribute to weight loss. Meanwhile, Contrave demonstrates moderate to strong effects on weight loss depending on the individual and has the most extensive research supporting its long-term use for obesity. Patients often ask me whether they can take generic Bupropion and Naltrexone separately to replicate the effects of Contrave. The answer is technically yes. Contrave is essentially a sustained release combination of both. Sustained release means that a medicine is delivered slowly over a long time. Unlike quick release methods that dissolve right away in the stomach and give you an instant dose, sustained release formulations release the drug gradually, keeping a steady and lasting effect. This helps keep a stable amount of the drug in your blood, often needing fewer doses and possibly causing fewer side effects. If clinicians want patients to take them individually, perhaps to cut costs or due to availability issues, they can combine a 100 mg dose of sustained release bupropion with a regular 50 mg naltrexone tablet split in half. While it won't be an exact match, as this combo provides 100 mg of sustained release bupropion with 25 mg of instant release naltrexone, compared to Contrave's 90 mg sustained release bupropion with 8 mg of sustained release naltrexone, it's a pretty close approximation. Will it be as effective as Contrave? It's difficult to say for sure since there haven't been direct comparisons, but for most people, it's likely good enough. So should you try these medications? It's important to note that these medications primarily target weight loss by influencing the reward pathways in your brain. This suggests that they might be more effective in addressing emotional eating and snacking rather than being a highly effective appetite suppressant. Research indicates that their overall impact on weight loss may be considerably weaker compared to highly effective appetite suppressants like Qsymia, Ozempic, or Mounjaro. However, it's worth mentioning that Bupropion and Contrave also strongly affect mood, and they come with a range of side effects and contraindications. Common side effects include dry mouth, insomnia, headaches, and nausea. Some individuals may experience dizziness or blurred vision, and in certain cases, an increase in blood pressure. Bupropion has also been associated with the risk of seizures. Additionally, mental health side effects such as anxiety, agitation, and mood changes may occur, requiring prompt medical attention if experienced. Therefore, their use is not without risks, and if you're considering them, it's essential to be evaluated by a doctor first. Hi, I'm Dr. Brian Yeung. Do you use any of these medications, and what are your experiences? Let me know in the comments down below. Subscribe and hit the notification bell to stay up to date, and if you found this informative, please leave me a like and share this video with someone you know who can use the info.